People love to feel that they have a voice, that they're heard. Many of my patients have been suffering for a long time. Even the 18, 19, 20-year-olds, some of them come in, they say, I've been depressed my whole life. And then I get the 60, 70-year-old who come in, I've been depressed my whole life, but I couldn't talk about it. Now I can. Our team has developed a clinic where you walk in and you feel at peace, you feel at ease. You should come in the door and not like a spa, not quite like a med spa, but you should be able to walk into our office and just feel, this is it. I feel at peace because I'm here. There's a friendly person who greeted me. It's a relaxing environment. There's soft music playing, so I'm gonna get the help that I need. When patients have tried 2 to 3 antidepressants, the chances of the research doesn't necessarily validate a greater chance of getting more benefit by having a 4th or 5th or 6th antidepressant, and so many have tried 8 or 9. So when we get to the point of 2, 3, 4 antidepressants without any benefit, or there's intolerable side effects, that's when I start to lead with TMS. It's extremely well tolerated. The patients, most of them have never heard of it, and so we explain, transcranial magnetic stimulation. We're using a magnetic wave to induce an electrical impulse in the brain to stimulate a part of the brain that we have found to be underactive in depression. Initially, we find a motor threshold, which means I'm going to take one of the magnetic coils and I'm going to map out a general location of the head in order to find the most appropriate treatment target. But when we do that, we start at we call it a pulse. I'm going to issue a magnetic pulse that may feel like a tapping. It's not going to hurt, and if it does, then we readjust until we find it so it doesn't hurt. But again, it's usually well tolerated. Of all the patients I have treated, I've never had anyone tell me that the mapping was intolerable. And anytime that we get to the actual treatment position, then again, if it is like a little uncomfortable, we just adjust and go from there. It's those moments when we get the validation of, this is amazing. You came in, and I'm excited to talk to the patient about it. You came in suicidal. You came in after either a suicide attempt or you've just been miserable all the time. And then you watch this transition of, they're more animated, they're more excited when they're talking. They're like, I'm gonna go do this. I had a 20-year-old, she said, I invited my friends over to my house for the first time in my life. And I'm like, that's amazing. She was more talkative, more animated, more excited. And so she had a significant response. I had a lady who was 67, maybe she was 72. I had somebody who was considered in the geriatric population. She came in, depression for who knew how long. And she said, nothing's ever worked. I've tried all these things. I've tried all this therapy. I'm to the age right now where I just don't want to be here anymore if it means I have to keep living this way. We started TMS, and again, watching this transition, she sends me pictures of her kayaking. She's going on these road trips. She's doing all these amazing things that young, spry people don't do necessarily. And she's 67, like paddleboarding, just all these amazing things. And she says, I have my life back. I chose psychiatry, first questions first, because I like people. People are interesting, why we do what we do. More of the psychoanalysis of, what was your motivation behind that? Like, why did that happen? But then there's so much more that you can't control, nature versus nurture. There's the organic, I'm acting this way because it's not a conscious effort. I have this chemical imbalance that's kind of perpetuating this issue or this problem or this behavior. And so it's like the combination of both of them is just fascinating. What it does, remission of depression, is fantastic. So being able to offer that to my patients in Utah, which is an extremely depressed state overall, is something that I feel is my responsibility as a psychiatrist to offer. So we're in the business of helping people. Myself, my team, my family, we all enjoy what we do. This is a group and a family endeavor. So being able to offer people the opportunity to get better, to have a voice, to feel heard, to not feel kind of just swept under the rug, or here, try this next medication. Patients, anyone should expect to be heard, to be listened. They should expect an explanation of the rationale of what's this process. Not here, take this. It's okay, well, I would recommend you take this and here's why. I tell patients all the time, you're in charge. Like, you're driving. I'm the GPS, so to speak. I've got the education, I've got the training, I've got the know-how, so I will guide you to what I feel is the best treatment to help you achieve balance.